So let me ask you guys a question. Tell me how you feel about care plans. Yeah, me too. I pretty well spent my first 6 weeks of school trying to figure out why I was doing care plans. So in my head, I thought it was either because my instructor hated me or because there was some magical rule book in the sky that said nursing students must use 50 reams of paper before the first semester is over and never sleep. Seriously, it really was like that in my head. I knew that nursing care plans were designed to help me provide evidence-based practice to my patient. And, I got that they were supposed to be like a blueprint for me, right? Or a template for me to follow every single day as I'm giving care to my patient. And I was all for the whole organized and efficient thing. I just didn't see what my role in any of that was. I didn't see that I was like that critical piece or that hub in the wheel, kind of. I didn't see any of that. I felt, in fact, the first 6 weeks of school like I had probably made a huge mistake in leaving my corporate job. There were a lot of things about nursing that were not what I expected, and this was one of them. I did not feel like I was making any difference at all. So I don't know how you guys are feeling about care plans. Hopefully you've found yourself in there somewhere. So I'm going to make a few videos about them. This first video, I want to share with you this point in time for me that changed the way I felt about care plans and, more importantly, my role in nursing. So I had a patient whose data I will protect here. Let's just say he had multiple rib fractures, long bone fracture, pelvis fracture, and he was 4 days post-op. He was getting ready to go home within a couple of days, provided that everything went well. I had gone into the hospital the night before, and I had gathered all my data, like good nursing students do, and I was at home with all my books spread everywhere, focusing on the things that were wrong with my patient. And like so many other times before, all I could see was pain and nutrition and skin integrity and constipation related to narcotics. And I was so frustrated by those same old care plans. Nevertheless, I went in to give care of my patient the next day, and my focus was going to be controlling his pain and getting nutrition in for him. I was going to teach him about some risky behavior that he was engaging in. Anyway, about 1 o'clock, his dad came around, and my patient wanted to get up out of bed a little bit. I knew that I needed to do that anyway, so I agreed to put him next to the sink that was right there by the bed so that he could brush his teeth, wash his face, comb his hair, that sort of thing. And I left with his dad sitting there to go next door to give meds to a patient. I get a call, the call bell, and it's my patient. I go into his room, and I'm thinking, wow, that's really fast. He got done quick. Instead, what I see when I walk in the door is my patient with a couple of rags up on his face, and they're getting pretty soaked through with bright red blood. There's some blood that's right here on his shirt, and I had this instantaneous moment of freak out inside me, and I went, holy crap, I've killed my patient. I felt awful and, gathered myself pretty quick and went about the business of taking the razor out of his hand because he was shaving his face and getting someone to help me come and get the bleeding to stop, which, by the way, took us almost an hour with holding pressure on the points of his face that he had nicked. So here's where this gets a little interesting. I had noticed that low platelet count on his labs the day before when I was at home with all my books spread out everywhere, and I had read what that means, and I knew that he was at risk for bleeding. But when I looked at what the doctor said was important, the doctor had not mentioned that at all. Therefore, for me, it wasn't important. After all, the doctor's the one that has all these years of school and experience. I'm going to trust the doctor. When all of that was over and the dust settled a little bit, what I came to understand was how this whole picture fits together, how none of the pieces of the puzzle that is your patient can be overlooked. I kind of saw my role in identifying what was abnormal in everything the patient was doing, not just the medical stuff, but I started to see that nursing diagnosis, they don't have to have anything to do with the medical diagnosis. And if I had really understood that when I went in to that day, risk for bleeding would have been probably at the top of my list because the patient's platelet count was very low. And when you don't have platelet high enough, you bleed. It's very simple. I'm fortunate, and so is my patient, that he didn't get up out of bed and fall and hit his head, or that he didn't go for some invasive procedure, because the outcome could have been much worse. And so, yeah, I felt very grateful that he didn't have any greater harm than a few cuts on his face that we had a hard time stopping the bleeding on. Mostly what I want you guys to get from this video is, very simply, your eyes and your judgment are really a key in the way that your patient recovers. Your patient's outcome really does depend on you to a large extent. Your doctor can't be there 24 hours a day, but guess what? There's a nurse with that patient all the time. If I had thought to call the doctor about that low platelet count, if I had thought to say something to anybody, all of that could have changed. But I didn't. So, care plans really do have some merit. They get much easier for you as you move through your semesters of school. Once you start to really understand your role and how important that is, they take on a whole different meaning. And you start to see that your assessment, your nursing diagnosis, your independent nursing interventions really are important. Just as important as what the doc is doing over there. You guys remember that whenever you're feeling frustrated and you're up way too late working on care plans the night before clinicals. I know that you can do it because you are, you're absolutely a fabulous nurse. And you're going to do amazing things in this profession that I just can't wait to hear about.
Until then, don't get frustrated by any care plans. Don't let them beat you. You guys have got this on lock. I know you do. And I will talk with you more about them in the next videos. Peace.